unless you've been living on Jupiter for the last 5 years, everybody is now well aware that targeting PI3 kinase and this entire pathway, BTK is yet another example, is really a ripe area in the treatment of many hematologic malignancies, and in particular in the treatment of lymphoma. We know that this entire signaling pathway is one of the most heavily mutated across all of cancer biology, and we know that lymphomas in particular seem to be very addicted to the dysregulation and dysfunction of this particular pathway. So to date, Deauville Isab is the first PI3 kinase inhibitor to be improved in this space. It specifically inhibits the delta isoform of PI3. There are 4 isoforms of PI3 kinase, alpha, beta, gamma, delta. That drug was approved for patients with indolent lymphoma in combination with Rituxan. Another PI3 kinase that's coming along rapidly now is Deauville Isab, formerly known as IPI-145. And this drug, too, seems to have very interesting activity in patients with follicular lymphoma and CLL. And those are the 2 predominant subtypes of indolent lymphoma where these drugs are getting a lot of attention. So those drugs have pretty good activity, but one of the issues with those drugs is that they've been plagued by some significant side effects. And the major side effects of those drugs to date seem to be increases in liver function enzymes, AST, ALT, a risk of diarrhea, and a risk of colitis, sort of a late onset diarrhea. There's some abstracts presented at this meeting trying to better characterize that colitis, looking at lymphocytic infiltrates of the bowel, and also pneumonitis. Interestingly, in a lot of those studies, there's about a 25 to 30% of patients or so that don't seem to stay on the drug very long because of these side effects. And so while they're very active and already approved and helping patients, there are efforts underway to try to find drugs that may not carry that same adverse or risk profile. And in fact, TGR-1202 is a once-daily PI3-delta inhibitor, so the other drugs are twice a day. And the early experience with this drug has also affirmed very interesting activity in patients with indolent lymphoma. But unlike some of the other PI3 kinase inhibitors, it has also shown some activity in patients with diffuse large B-cell lymphoma. But maybe the more interesting finding to date in a study done by a number of investigators around the world, including Skip Burris from Sarah Cannon, is that it hasn't produced the same degree of liver function test abnormalities, nor has it produced the same incidence of diarrhea. And to date, a lot of people have been skeptical of those findings, primarily because the onset of colitis and the onset of diarrhea in patients treated with Deauville Isab and Deauville Isab seems to be a little bit later, about 6 months or later. And so as we've been treating these patients, we've been trying to get to a point where we have enough patients in follow-up beyond 6 months where we can comfortably say, yeah, this side effect profile seems a little bit different. And that's about where we are now. There's about 66 patients, I believe, that are beyond that 6-month point, and we're just not seeing that same incidence of colitis. We don't see the same incidence of LFT elevation. And we haven't seen any real pneumonitis to date, no pneumonitis. So this study is now continuing to accrue patients with a variety of types of subtypes of lymphoma. There's now a registration-directed study in patients with CLL that's being led by Dr. John Gribben from London. And the company is now planning other regulatory studies with their PI3 kinase inhibitor and other novel anti-CD20 monoclonal antibodies. So I think time will tell. I think over the next couple of years we'll learn a lot more about the immunologic dysregulation that may accompany these drugs and maybe find strategies on how to better manage the colitis and pneumonitis. But I think that finding drugs that have the same efficacy with less or a more favorable toxicity profile, I think, is something that could translate into better compliance, obviously, for patients, and hopefully that translates into better long-term efficacy.